Warning, this episode contains brain food that will lead to improved emotional and social intelligence. Hello and welcome to our new short format servings of consciously prepared brain food designed to improve your mental fitness. This is Lisa Cypers Kamen, your host. For more than 12 years, we've been proudly and consistently crafting harvesting happiness and sharing it with you. Each week, we spotlight diverse thinkers and doers who are contemporary trendsetters and change agents devoting their lives to creating a better world in which to live. We invite you to listen up and change the way you think about human happiness. Our award-winning content is fresh, optimistic, and purpose-driven media that promotes well-being from the inside out. Alrighty then, let's dive in. This episode offers psychosocial education designed to inspire and motivate our listeners. The information provided does not constitute a therapeutic relationship nor a substitute for professional mental health care. If you are experiencing a mental health crisis, call 911, go to your nearest emergency room, or for listeners in the United States, text 988 for the National Suicide and Crisis Lifeline. Hey, Lisa, your host here. Just a quick heads up that the content of this episode might not be suitable for all audiences. We are talking about a mature subject matter today. Good morning, good afternoon, and good evening, wherever you are. Thanks for joining me on today's show, where you will learn about sex-pectations and getting it on at any age. My guest today is Dr. Regina Koepp. She is a board-certified clinical psychologist, clinical geropsychologist, and founder of the Center for Mental Health and Aging. She is the creator of the only dementia and sexual health certification course in the country and is currently the lead medical psychologist at University of Vermont Medical Center. I'm so happy you're here, Regina. I really am. I love talking about this.
Thank you. I'm delighted to be here. It's my favorite topic.
I think probably most of us as well. So there's a common misconception that older adults are no longer interested in or capable of having sex. That is a big, fat myth.
Correct. That is a big, fat myth that I'm glad we're going to be busting today.
Yeah. Talk about these stereotypes and how they impact the sexual health of older adults. And I guess I can put myself now in that classification. You know, not quite Medicare ready, but getting there.
Yeah, if we're lucky.
Yeah.
If we're lucky, we'll all get there.
Yeah. So talk about it.
Yeah, so there are lots of myths and misconceptions about sexuality as we age. One of the most common myths is that at a certain age, we're no longer interested in sex. And that couldn't be further from the truth. There was a big study in 2018. Researchers surveyed 1,000 people between the ages of 65 and 80, and 67% of those people were interested in sex. So this myth that at a certain age we lose interest is incorrect. There's also a myth that if we're older and sexually active, that it's perverse or abnormal. It is not perverse. It's not abnormal. It's normal, and it's an important part of the human experience.
Indeed. Let's talk a little bit, though, about when we talk about interest versus frequency, because as we age, we have different priorities, maybe different health considerations. What happens to our frequency as we age, and is it really quality over quantity?
Yeah, well, I think it's different for different people. So the same study looked at like what percentage of men and women were actually having sex, not just interested in sex. And so having sex was either like sex with a partner or masturbation. And the survey found that, remember, this is 1,000 people between 65 and 80 years old. And it found that close to 51% of men and close to 31% of women were sexually active. In other studies, I've seen that the frequency in some studies is the same as other age groups. And then I've read other studies where as we age, the frequency might be less, but the quality is heightened, that people who know their bodies well and know their partners well actually enjoy, as we age, we actually enjoy the experience more because we know our bodies better.
I'm going with that, right?
Yeah.
That it becomes quality over quantity. Whereas when you're young and in your procreation years, you're a little bit more rabbit-like.
Yeah. Well, is that true? Are you willing to talk about your own life?
Of course, I'm willing to talk
Is
about
that
my
is
own
that
life.
true in your own life?
Yeah. Yeah.
Yeah.
So, but I think that as I age, and I think this is the experience of many contemporaries that I speak with, it's like you're pulled in so many directions. Many of us are now in the sandwich generation where we're
Hmm.
still actively parenting young adult children or children in the home. And there are aging relatives that are either in the home or in the orbit that really make you feel a little bit crunched. So the last thing you feel like doing when you hit the pillow at night is having sex because you just want to sleep.
Yes. Yeah. I get it. Yeah. I'm 47 and I am in the squeeze. I have little kids. I started having kids in my 40s. And so after I had kids, my libido, I had kids and now I'm in perimenopause. So my libido is like in the ringer. But so my hope is that I have to stick with it so that my libido maintains as I get older and I go through the menopause. But to your point, Lisa, there's this U curve of well-being as we age. So the U curve of well-being basically looks at rates of well-being across our lifespan. And this stage of life, like between 45, I think it's probably like 40 and 55, is actually the lowest on the chart of well-being. That our well-being is highest in childhood and older adulthood, but between like 40 and 60 or 45 and 60, it's the lowest. And to your point, it's related to being in that sandwich, the squeeze generation, squeezed between kids and aging parents who might need help, and both groups may need our help in very unique ways. And so lots of life transitions. And then also in that squeeze zone is that we might be at a really important part of our career, a really critical part of our career where we finally have some authority in our roles, but we might be managing other people in our careers too. And so that adds a layer of stress as well.
Let's talk about that for a second, doctor, because when you have the sensation that you're managing a lot of people, it's like that also is a sex dampener, right? Because you just like feel like, I just want to exhale and not have to take care of anything or anybody.
That's right. Yeah. And we know that like when people are more stressed, it impacts libido. So we're more likely to be sexually active and sexually aroused when we are more relaxed, which is why people tend to have more sex on vacation. And so when we're managing a lot, career, children, parents who might have illnesses, and a team at work, our libido may very well take a hit.
So that's the downside. The upside is that older adults are still having sex, and there's a lot of benefit to having sex later in life. Tell us about all those fabulous benefits.
Yeah, and there are benefits all throughout, our consensual life of having sex for having sex. But in older adulthood, those benefits maintain. And so those benefits are that let's see, even people who are having sex or maintaining an active sex life as they age, and this could be masturbation, it could be with a partner. If you're solely a masturbator and you want the maximum benefit, then just make sure you have a really thriving friendship life as well. But for people in relationships who are sexually active, the benefits are that people report a greater sense of well-being, a greater sense of life satisfaction, less anxiety, less depression, and that even more health benefits. So when you're using your body, it's for sexual activity, it's like exercise. So people tend to
I
have
love
healthier
that.
hearts. Yeah. So healthier hearts and healthier brains. So actually people who engaged in like older adults, so this is people like above 65 who engaged in more frequent sexual activity and I believe it was actually sexual intercourse, had scored better on cognitive tests than people who engaged in less sexual intercourse.
Well, I can see why, right? Because you're clearing the cobwebs from your brain and other regions. I get it.
Yeah. And also, if you're more physically healthy, that has a correlation with brain health as well. Like if your heart is healthy, you have a better chance of your brain being healthy.
Good point. So it contributes to cardiovascular fitness.
Yep. Cardiovascular fitness, cognitive fitness, psychological fitness, interpersonal relational fitness, and some even say like spiritual fitness in terms of the sort of act of reciprocity and generosity that can happen in lovemaking and connection.
I think that's true. And I'll speak from my own experience as I've aged, that component, the sort of spiritual communion, if you will, and that's kind of
Mm-hmm.
a woo-woo word to use, but like that connection is also of the heart and mind, not just of the flesh.
Yeah, yeah, I really relate to that too.
That's a really nice thing about sexuality, I have found as I've aged. Let's talk a little bit about sexually transmitted infections among older adults, because many older adults are coming into the world dating later in life. They're
Hmm.
divorced or their partners have passed, and they're sort of re-entering this space.
That's right. Yeah. Yeah. So STDs, specifically gonorrhea, syphilis, and chlamydia, each of those STDs have doubled among people 65 and older in the last 10 years.
Wow.
Yeah, it's a real concern. That's not the case for HIV, and there is reason why, which I can go into. But
Yeah, tell us.
looking, yeah, okay, so STD, HIV hasn't increased. It's stayed the same in terms of the number of people over 55 getting diagnosed every year. Um, and that's because many people who were diagnosed with HIV maybe decades ago have been using antiretroviral medications. And that actually helps to keep their viral load of HIV low in their body, so that actually their risk of transmission is lower as well. There's also PrEP, which is a pre-exposure prophylaxis that some people who are really sexually active take if they suspect that they might be having sex with somebody with HIV. A person might take PrEP to help prevent any transmission, them receiving HIV. So that's helped to sort of squash a lot of new HIV diagnoses that we would see in the past. That sort of squashed the rise of HIV. I will say with HIV, it's unique because actually more than 50% of people living with HIV are over the age of 50. And that's because
Wow.
of antiretrovirals. So, people who are listening to your podcast probably remember the HIV crisis and epidemic. And it was a terminal illness, of course, when it was, we were first exposed to it. And now people are living a full life
Yeah.
with antiretrovirals. And so it's just seen as a chronic illness that we need to manage and maintain.
When I was a young person in the 80s, that was something to be feared. It just was
Yeah.
like, you don't have unprotected sex, until you test. And
Right.
I don't know that people do that anymore.
Yeah, well, many older adults do not, and so this is some of the cause for what's causing the rise of chlamydia, gonorrhea, and syphilis, and that's because sex education for people who are 65 and older currently was not a thing in school like sex education was for me in the 80s when I was growing up. That research shows that many older adults actually see their risk of transmitting an infection is very low, and so tend not to use a condom since they're not worried about pregnancy anymore. But the risk of not using a condom means that you might be more exposed to STDs. And so that's part of what's causing the problem. Another piece is that doctors are not talking with older adults about sex. And because of these misconceptions that older people don't have sex. And so in that study, of 1,000 older adults between 65 and 80. And remember, many of them were having sex, and many of them, the vast majority, were interested in sex. You remember, 67% were interested in sex. But when they went to their doctors, only 17% of the time were their doctors talking about sex with them. And when those conversations did happen, the older adult was the one bringing it up, not the doctor.
It's interesting. I had an uncle who lived in a retirement community. My aunt had passed, and he was a really handsome, single widower in the retirement community. He was like a prized bull. Like the ladies
Yeah.
loved him, single, available, and he would talk about it. He loved talking about it.
Oh yeah. Well, and imagine, there are more women who are 65 and older than men, and there are more straight people, right? So if he wanted to be with a straight woman and he's a straight man, he would have his pick of the litter.
Every day of the week, I suppose. I never asked him because I didn't get that far into the conversation, but I knew that that was a thing because we did have a conversation about that. Let's take a break. And when we come back, we are going to continue the conversation with Dr. Regina Koepp. We're talking about getting it on at any age. To learn more, please visit her website, mentalhealthandaging.com, on Twitter, Facebook, and Instagram, Dr. Regina Koepp, and that's Koepp. Here comes the pause. We'll be right back. Hang on just a minute. Before we take that break, let's talk about how good hair days are always happy days. And one of the ways I get to have great hair days is with Nutrafol, the #1 dermatologist recommended hair growth supplement that's clinically shown to improve visible thickness and strength. Did you know that approximately 1 in 2 women are or will be impacted by weakened or thinning hair? If you're among them like me, you are not alone, and there is a solution that you can trust to deliver great results. Nutrafol supports healthy hair growth from within by targeting the root causes of thinning from within: stress, hormones, environment, nutrition, lifestyle, and metabolism through whole body health. In a clinical study, 86% of women experienced improved growth after 6 months of using Nutrafol women's hair growth supplements. Nutrafol has multiple formulas, including vegan, designed for women of all ages and life stages. Each physician-formulated product is made with natural, drug-free, medical-grade ingredients in consistent doses for reliable results that I have experienced firsthand. What I love most about Nutrafol's whole body approach to health is that in addition to thicker and stronger hair, the ingredients have stopped excessive shedding while helping improve my sleep, stress response, and those pesky menopause symptoms, including hot flashes. Who wouldn't want that? If you're tired of thinning hair, Nutrafol is here to help. Visit Nutrafol.com and take their hair wellness quiz for a personalized plan that targets better hair growth through a whole body health approach. Join me and millions of others who are celebrating great hair days with Nutrafol. Take the first step to visibly thicker, healthier hair. For a limited time, Nutrafol is offering our listeners $10 off your first month subscription and free shipping when you go to Nutrafol.com and enter the promo code HARVESTING. Find out why over 4,000 healthcare professionals recommend Nutrafol for healthier hair. Nutrafol.com, spelled Nutrafol.com, promo code HARVESTING. That's Nutrafol.com, promo code HARVESTING. Now let's take that pause. Research tells us that happiness is good for our health. Happy people live longer, are more productive, and make better partners, parents, and professionals. Connect on Facebook at Harvesting Happiness and follow me on Twitter at Lisa Kamen for nutritious helpings of positive goodness. One thing I know for certain, happiness waits for no one, and at times we all need a little support. To learn more about cultivating sustainable well-being at home and at the office, visit harvestinghappiness.com to explore experiential online and on-site optimal lifestyle management consulting services, including recovery fortification and life crisis triage. Hey, Lisa, your host here. Just a quick heads up that the content of this episode might not be suitable for all audiences. We are talking about a mature subject matter today. And we're back with my guest today, Dr. Regina Koepp. We're talking about sex-pectations and getting it on at any age. Let's return to the conversation. So, Regina, let's talk now about health concerns and new disabilities or chronic illnesses that arise as we age, because inevitably things happen, parts start to wear out.
Yes, hearts wear out. Maybe we get arthritis and pain interferes with our sexual functioning.
It's the knees.
The knees, the hips. My hips are different. Diabetes, all sorts of things can impact sexual functioning. And then the medications for those things can impact sexual functioning. So that can be really tricky for couples who, like maybe one person is experiencing more ailments and so more limitations, and the other partner has the same libido that they've always had. And so that can create a mismatch in a relationship that's really hard for couples to navigate. And so I'm glad we're talking about it.
Yes, let's dive into this, because I have heard this discussed many times. He wants it, she doesn't. She wants it, he doesn't, or not as much, or at different times of day. What do we do?
Yeah. And you've heard that like with your friends or on your podcast?
No, with friends, with just, people in my orbit, and I think that other interests that develop. And then there are the very real things, as I have my own aging parents, and one of them, my dad in particular, is very honest about talking about this, that he would like to have that part of himself, but he has so many other things going on.
Yeah.
And his wife also, that it's not possible, and it's a place of sadness.
Yes, it's a real loss and a point of grief for many people.
And this is where the psychological component comes in, right? How do you advise or guide your patients that, let's say they really are near the ends of their lives in their 80s or 90s, and they still got the spark, but there's the reckoning with what the body cannot do.
Yeah, and that's true for people in their 80s and 90s. It's also true for people in their 60s and 70s who have conditions like Parkinson's disease, or really significant chronic pain, or heart disease, where they have the longing, but their body is not cooperating. And that first, I think it's very important that people acknowledge the loss and kind of engage in their own grief process. I think that does take some time. It's a transition to get to know your body as it is now. The tricky thing is that we often enjoy having sex in a relationship with somebody we love, right? And so this mismatch that we're talking about too is really profound in relationships who are experiencing an illness. And so, what I often will recommend is that the couple sort of get to know each other. If they're wanting to spark intimacy and the body is not functioning. So, what can happen often for bodies? So, if a person's living with Parkinson's disease, physiologically, because of the changes in the brain and the neurochemistry in the brain, the body might not actually physiologically be able to generate an erection. Or if a person's experiencing chronic pain or heart disease, chronic pain, you might not be able to get into positions that you enjoyed before. Or with heart disease, you might not be able to generate an erection. Or for many women, lubrication can be an issue, or pain with sex can be an issue. And so if that's the case for couples, then I recommend sort of, one is engaging in some adjustment and grieving process to your own body and to what that means in your relationship. And that can take some time. You might be able to do that on your own, or you might want to do that with a professional like a therapist who specializes in chronic illness. That can potentially be helpful. But in terms of your relationship, what I would say is to find, if you're wanting to cultivate intimacy, that perhaps to shift your sex-pectations a little bit from orgasm or erection or lubrication being the goal to intimacy being the goal. Like, can we spend time together fondling and caressing and just spending time getting to know each other again? And of course, that's hard to do if you're in the midst of frustration and grieving the losses, your frustration with your body. And so that grieving step is really important. An adjustment step is really important. But so if couples are wanting to cultivate the intimacy, you could do, I was just collaborating with the American Parkinson's Disease Association on something called the Parkinsex Kit. And and we came up with lots of different things that couples could do. One is to really schedule time for intimacy. So as we were talking about, Lisa, people are busy, our lives are busy. There are a lot of demands on our time. And we often put sex off. We'd rather sleep sometimes. I know I would. My day is so busy that I want to just go to sleep at 8 p.m. And so, and that used to be a time my partner and I would be intimate, right? But to schedule time for intimacy and really protect that time and then create a space for that. And so creating a space might mean shutting off all electronic devices and TV, turning on some music, turning on a candle, creating an atmosphere of sensuality. And then, like I mentioned, to adjust your sex-pectations, maybe erection is not the goal. Maybe it's just sensual touch that's the goal. And then I like to encourage folks to, like when I'm doing psychotherapy with couples, who are wanting to improve their intimacy, I invite them to tell me stories about when they were the most aroused with one another and when they had the most intimate, passionate time in their relationship, and to really describe it in detail. And so if you're in a room with your partner and you've protected the space and time, then I invite you with your partner to talk about, oh, do you remember that time? Like for me and my partner, when we were dating, he would come to my door and I would open my front door of my apartment and we would just embrace and like passionately kiss. And it was so romantic. And we just had the best sex early in our relationship, like right until we had kids. And
Of course.
always the kicker is the kids.
Yeah.
But so if it were me, my husband, I would be reflecting on that moment in time and really like describing in elaborate detail the sort of arousal and sensual experience that we had and that time that we could share together. And that can sometimes like get the juices flowing in your body. Sometimes libido gets sparked by these kinds of discussions and this kind of, it's kind of like writer's block, right? There's a saying about writer's block, like you just have to start writing and then the ideas will start flowing. It's kind of similar for some people with sex that you just kind of have to like set the mood and kind of start the process a little bit, and then the libido can kick on. That's true for some people.
I was going to say like that the foreplay starts way, way early in the day, even unrelated to the prospect of the sexual encounter.
And I mean, I guess it depends on your partner, what foreplay your partner enjoys. So I think checking in with your partner earlier on, I'm thinking of, we are kind of describing heterosexual relationships. Same is true for same-sex relationships. Like really libido is based on the person. It's not really only based on gender. And so it's really important to check in with your partner about like, what does great foreplay look like for you? And I'm most connected to you when you are curious about me and my day, when you help me with the dishes, when you help me with the kids, or when you help me with the laundry, or whatever it is.
Guaranteed the deal will get sealed with that.
Right. If we're a team, then I want to be I'll be a pitch hitter later in the night.
It's so funny. And it's like so unrelated, but related, right?
It's so related because it's all about like, are you there for me? Do you trust, like, can I trust you? Are you reliable? Is this a person that I want to be vulnerable with and open up to? And is there an active reciprocity and generosity? And so I think foreplay earlier in the day, like, are you helping with the dishes? Are you helping make the dinner? Are you helping notice what needs to be done around here so it doesn't all fall on me? That to me are sort of recognition and acts of reciprocity. And then that extends into the bedroom.
Love this. Let's go back to coping with new disabilities. Several years ago, we had done a show on sexuality and trauma. And the guest was talking about all kinds of devices, and I don't mean just sex toys, but appliances that can help people who have a disability have a healthy sexual life.
Yes. So for 10 years, I worked in a spinal cord injury clinic at the Atlanta VA healthcare system. And so many of my patients had spinal cord injuries, may have been paralyzed from the neck down or the waist down. And so maybe couldn't generate an erection with their mind, right? And they couldn't get their blood to flow in their penis. And so through thinking or through arousal in that way because of the spinal cord injury. And so there are things like penis pumps, which is like an apparatus you put on your penis and you pump it to get the blood flow into your penis to generate an erection. There are things like creams. I'm thinking also I work with many men who had prostate cancer and maybe the radiation or surgery or whatever method they used to combat the cancer impacted their erectile function. And so would maybe use a penis pump, have tried using penis pumps and creams. If people are interested in these, I would encourage you to ask your primary care provider for if they know information about this. And if they don't, ask for a referral to a urology clinic. So urology is like the clinic for men, especially that manages, urine. Yeah. Urology is like that we use for urine. And so in your urethra. But urology is really great at helping men, especially post prostate cancer, understand how to use their body for sexual activity again. And for women, I would talk with your OB-GYN. The issue or is also that I think that because of aging and misconceptions about aging, many OB-GYNs might not know, but some might. Like I think I think you had talked with somebody who had a women's clinic, Lisa, who made some recommendations. And so there might be resources out there from a gynecologist who specializes with aging and give you some tips on what you could try.
Because I think there are lots of things out there that are non-pharmacological that one can utilize, to augment. And I think that's really helpful. We're nearly out of time, and I wanted to touch upon another subject related to sexuality, and that is dementia.
Yeah.
People who are experiencing, extreme forgetfulness and dementia, whether it's Alzheimer's or other dementias, and the impact on their sex drive or even ability to have sex and interest.
Yeah. So, just as we have a lot of misconceptions about sexual activity as we age, I think there are also a lot of misconceptions about sexuality in the context of disability like dementia. What's tricky with dementia is that over time, with the disease of dementia is a neuro, meaning brain, illness. So it's a chronic and terminal illness. Alzheimer's disease, which is the most common form of dementia, is the fifth leading cause of death among people 65 and older. It's a chronic and terminal condition. So it's a degeneration of the brain, and it impacts functioning. And so, but what happens is it doesn't mean that a person's desire for intimacy goes away when they have dementia. And so one thing that I do is provide consultation and guidance to long-term care communities and professionals who are working with people living with dementia in memory care communities who are starting intimate relationships with other people with dementia. And so I help communities sort of navigate, can the two people living with dementia consent to intimacy, and how do we know, and is this okay, and what if it's not okay, then what do we do? But the point, I guess, what's really important here is that even when people are living with disabilities, intimacy, like a dementia disorder, even when our memory can go, our need for connection and intimacy can still maintain. And that's not necessarily a bad thing. Like, it doesn't mean that everybody needs a hands-off policy who has dementia. And so we just have to help people with dementia sort of navigate that safely so they don't get exploited, or so if they're hypersexual, because that can happen too in the context of dementia, that a person's hypersexuality doesn't harm somebody else with dementia.
Well, that makes good sense. Or that I would imagine also that the in and out that some dementias cause, where you're very, very present and aware of what's going on 1 minute, and then that could change,
Yeah.
Very rapidly. I would imagine that could be challenging.
That's right. Yes, it is. And so consent is moment by moment, right? An ability to consent is moment by moment. And our capacity is also moment by moment in some cases. So when we have a determination of our capacity to consent to intimacy, like, can my brain do this? Can I understand that I'm having sex with somebody? That capacity can change the next day depending on how your brain is doing. And so it's very delicate balance of figuring this out, and making sure people are trained in this is really important so that they can help a person with dementia.
Dr. Koepp, what I gleaned from this conversation is we should keep having sex so we could keep having sex.
Yes. And because, well, let me also just say that on Maslow's hierarchy, sex exists at the very base and in the middle. And so you remember, like, Maslow's hierarchy of needs.
Yes.
So it's at the very base, like with eating and excretion,
safety,
and sex is there. And so it's part of human functioning. Like, it's part of our bodies will do it. It's why we have wet dreams, right? It just, we have a innate desire to be sexual. It's just part of our makeup as humans. And it's in the middle because we need also relationships. So sex is very basic in that it's a function of excretion, right? with lubrication and with ejaculation, but it's also intimate and relational. And so it's all of these things, and we need it in our, it's not only we should have sex because we need to have sex. We should have sex because actually it's a human need.
Yes. And it's good for us mentally, physically, spiritually, all the things that we've been talking about.
That's right. Yeah. As long as it's consensual, which is in the case of dementia.
Yes. Yes. We get it. No really is no. It is a full sentence, says Jane Fonda.
That's right. That's right.
Well, thank you for joining me on the show today. Please come back and let's hang out more because, this is important to talk about, and it's important to destigmatize. This conversation should have no shame. It should be just part of what we as humans talk about as well as do.
Yeah. How is it that we can talk about eating without shame and it's at the same place on the hierarchy? Maslow's hierarchy.
Exactly. So thank you to my guest today, Dr. Regina Koepp, for reminding us that we can get it on at any age and we have to manage our sex-pectations. To learn more, please go to mentalhealthandaging.com. And on Twitter, Facebook, and Instagram, you can find Dr. Regina Koepp there, and it's Koepp is the spelling of her last name. Thanks so much, Regina.
Thank you. I enjoyed being here today.
Me too. Thanks for joining us on Harvesting Happiness today. This is Lisa Cypers Kamen and my guest, Dr. Regina Koepp, wishing you kind thoughts, kinder words, and the kindest of actions. Until next time, remember, happiness is an inside job. Happiness is your inside job. Please go out and rock your day and remember to be kind to one another. Keep harvesting your own happiness anytime and anywhere from the comfort of wherever you are. Subscribe, listen, and share hundreds of downloadable episodes from our mental muscle toning libraries at harvestinghappinesstalkradio.com, toginet.com, iTunes, Google Play, Amazon, Spotify, or wherever you get your podcasts. To learn more about my global consulting services, please visit harvestinghappiness.com. Spread more joy by liking us on Facebook at Harvesting Happiness and following me on Twitter at Lisa Kamen. Harvesting Happiness is produced by me, Lisa Cypers Kamen, Andrea Mengele, Robin Boyd, Andrea Daly, and the awesome team at Podfly Productions, including Eric Begay, Kimberly Beck, and Alec Gus, in collaboration with TogiNet Radio, KBUU, RadioMalibu.net, and is available on PRX, the Public Radio Exchange.